When you come in for your evaluation, we spend some time assessing your entire body. So I'll ask about your medical history, any big things that might be impacting your current status, kind of why you're here and what your goals are for physical therapy. From that point, we'll assess kind of your function as a whole, how your body can move and balance and get around, and we'll break it down to look at isolated muscle groups, taking your whole body as a full human and identifying any impairments that might be leading to why you've come in today. So finding the biggest impairments and then the exercises to fix those specific things.
Patients would say, you guys are doing things differently. They would go to a place where it looks like a gym, like one machine after another. Here we call our company Orthopedic Balance Therapy Specialists because we are big on supporting our clinicians, earning each what their passion is. For me, orthopedic part of it, I am a manual therapy certified. When you have certification in manual therapy, you have an advanced understanding of how each muscle and joints move and how they function together. Manual therapists have specialized techniques to improve your movement through hands-on techniques.
I have extra vestibular and balance type training. So that means if you're feeling dizzy or you're unsteady and you come to see me for physical therapy, I will do an assessment that kind of identifies where your balance or dizziness problem is coming from to treat that specific impairment. I have a certification for kinesiology taping. I have extra courses working with people with dementia and kind of the memory care population. And then this company is helping me pursue a dry needling certification in the next couple months. Here, it's a lot more individualized for each patient, kind of adjusting things to match their current status, their current deficits, and making their lives improve to meet their standards, kind of what they need to be doing. Considering the whole body approach is done really well here. So looking at someone with back pain as someone who might have their hips or knees contributing to that back pain rather than only treating that one area.
Some of the patients who come in would say, I saw Dr. So-and-so, and I have done this XYZ testing, and then they didn't find anything, so I'm here, figure it out. And I love that. That's the part of the vestibular rehab that I love. When everything, every single test is negative, then I tell the patients I like it because I'm working with an intact anatomy. We won Best in the Region for 5 years in a row. That is because of our patients. They vote for us every day.
My favorite part of what I do is when people feel like they're not going to be able to get back to doing what they love, helping them do that. So incorporating aspects of that into every treatment session, not just doing strengthening the entire time, but using those components in a functional way that's going to get you back to your hobbies or, things with your family that you weren't able to be a part of. So seeing people get back to doing those things is my favorite part. They're like, hey, I can get my shoe on without a shoehorn, right? Or I can walk through the grass without tipping over and I can go watch the fireworks on the 4th of July. Like they're just like those little things that they come in and they're excited about. Those are really special.
Patients will always stop in and say hello if they're just passing by, and a lot of times patients will bring us in like coffees and stuff just to like give us an extra little thank you for everything that we do for them. And I don't know, they just become family over time because we see them so much.
Very laid back here. We have fun. We have fun Fridays. Different theme every Friday, like this coming Friday. We're celebrating Father's Day, so everyone is to come in a tie.
It's socially very laid back, but clinically very on point, using evidence-based practice to make sure that our outcomes with our patient care is as effective and efficient as possible.
Let us help you live an unhindered life.